Oh, didn't see you there. We're reacting to Illymation's Fun Time at the Dentist video, which was a request by one of my subscribers. And we're going to be reacting to this video with a dental perspective.
I'm not putting anything else in this mouth except Laffy Taffy. Good day, sir. We still need to fill that cavity. I said good day.
In the first part of the video, the baby canine was still in the gum when the adult canine came through, and that meant that Illymations had to have the baby canine removed. When they removed the baby canine, they realized that some of the other adult teeth were crooked as well, and so they started braces. After finishing the braces, they noticed a bit of jaw pain, and that's where we start today's video.
As the years went on, my jaw popping turned into jaw pain. The corner of my mandible in particular ached, sometimes for days at a time.
So I think there's actually two things going on here. Firstly, there's a jaw issues. And secondly, there's some pain in the corner of the jaw. So that kind of sounds to me like it might be related to wisdom teeth coming through, which would line up roughly with the timeline. So Illymations had braces completed, and that would have been roughly 14, 15 is my guess. And a few years later, that's when wisdom teeth can start to come through. And they generally come through a little bit earlier in women compared to men.
So I thought, maybe my head hurts because I have horrible posture. But yoga didn't seem to help. So then I was like, maybe my teeth hurt because I grind them at night. So I finally got that mouth guard.
I'm not sure if it's just the animation, but the night guards that we make are generally white or clear colored. Those ones are custom made so that there's no stress on the jaw. The fact that it's a pink color makes me think that it might be a mouth guard instead of a night guard. It might be one that's made just to protect the teeth from grinding or made for sports instead of specifically to rehabilitate the jaw.
But that didn't fix it either. But then, one fateful October, I went to the dentist for a checkup. They took some x-rays of my face bones and said, "Did you know one of your wisdom teeth is impacted?" Is what? It's coming in sideways?
They would have taken an OPG for that x-ray.
And pushing up against all your other teeth. Is that causing you any pain? Nope, not that I'm aware of. And then I went home and experienced this mysterious pain for another 6 months.
Generally, wisdom teeth that cause repeated instances of pain are because of pericoronitis. And that's where the gums around the wisdom teeth flare up when bacteria gets trapped in and around there. Usually those symptoms will last a few days and then it will resolve on its own. However, sometimes the tooth above it can start to bite into it, which causes this negative feedback loop where it swells and then it gets traumatized, which causes it to swell more. In those situations, you might have to see a dentist to get it flushed out, and ultimately it's best to get the wisdom teeth removed to avoid those situations again.
I thought I was simply doing my time for my TMJ teeth crime, until finally I realized, wait a second, maybe it is my wisdom teeth. But that meant I would have to have surgery, and the thought of it terrified me. Also, I'm a redhead, and apparently we need more anesthesia for some unknown reason.
In dental school, I remember my professor telling me that redheads need more anesthetic, and the reason why he said is because they experience pain differently. Now, I'm not sure how true that is, but in practice I do give redheads more anesthetic because I find that it takes longer to numb them up, and also the anesthetic does not last as long.
So what if I wake up in the middle of it? But also, what if I don't get this surgery? The pain will only get worse and ruin my teeth. So I knew what I had to do. I swallowed my pride with a banana Laffy Taffy, the best candy despite what Good Mythical Morning would have you.
Try not to eat too many Laffy Taffies. Sticky sugary lollies, they'll get into all the grooves and in between the teeth, and sometimes they can sit there for a long time and cause cavities. Eating them at Halloween is fine, but don't have it on a regular basis.
And finally, I went in for a consultation. So what do you do?
Interesting how the dentist here is drawn. In Caitlin Flame's and in Jaden Animation's videos, the dentist is drawn holding very big instruments, whereas this one, it looks like the instruments are pretty much the scale. They look very small, but I think that's more so because the heads of the characters are quite big.
The staff was super stoked to find out I was a YouTuber, which was a pleasant surprise. And I remember
have
the
a YouTube
surgeon
channel
asking
too,
me,
so subscribe
"So,
if
you
you
think you're gonna
like."
make a video about your wisdom teeth? Are you gonna animate me?" And I said something like, "Maybe, if something crazy happens."
Oh god, the foreshadowing.
And soon enough, the surgeon came in, ready to steal my teeth. He sat down, hooked up the anesthetic to my IV. I took a couple deep breaths. I was out. Next thing I know, I'm sitting in a chair, medically high.
Finding Nemo at the dentist. Classic dentist trope there. And we've also got a little Pokemon on the other side.
I see it.
and my jaw never hurt ever again. The end.
I'm surprised that the wisdom tooth surgery fixed all of Illymation's problems because it sounded like there was a jaw clicking problem as well as a wisdom tooth issue. However, as the jaw develops, it might have evened out and some of those problems might have improved. Now, I'm just speculating here, but it sounds like it might still be a good idea for Illymations to wear a proper night guard to help protect the jaw. The added benefit of the night guard is that it'll help to hold the teeth in place, similar to how a retainer would.
After years of not having braces, my teeth have begun to shift a little bit, so I started looking into aligners to wear at night, which is
Oh, so it sounds like Illymations did not continue to wear any retainer or night guard because the teeth have moved again.
which is why I'm happy to say this video is sponsored by Bite. Bite off.
So if the teeth move after braces, then that's what we call relapse. In those cases, we can do some clear aligners to straighten them. However, personally, I am very against these do-it-at-home kits because I've seen a lot of complications with them. Yeah, that could be a whole other video. So let's end the video here.